Hello, I'm Sandra Barrington, Executive Director of Sierra Nevada Memorial Hospital Foundation, and welcome to Doc Talks. This is a series where we bring local physicians to you so you can learn more about who they are, how they got to where they are in their lives, and a little bit about what they do in the community, their specialties, and maybe something about what they think the future of healthcare might be in our community. And today I have a very special physician with us, one of our current residents training in our family medicine residency program, Dr. Nick Sparr.
Hi, thank you for having me.
Yeah, thanks for coming in,
Absolutely.
and so we can learn more about what it's like to be a resident. Nick is the first cohort and will graduate in 2026.
Fingers crossed. Yeah.
Yes, our first graduating class, so very special to have him in today. So Dr. Sparr, why don't you tell us a little bit about your educational background and what got you to this point in your healthcare career?
Sure. So for anyone becoming a physician, the route requires 4 years of undergraduate undergraduate education, 4 years of medical school, and then at least 3 years of residency training after medical school. My path included all of those. I did undergrad at Grinnell College in Grinnell, Iowa, but at the time I thought that I might go into journalism.
Oh, wow.
That didn't pan out, but I had the degree in English and then transitioned for a few years there into nonprofit work, and then eventually made the decision to go back to school to apply to medical school. So took the pre-medical school requirements, applied and went to the University of Iowa, and then when I was applying to residency programs, wanted to come back to the West Coast and chose this program, and am happy to be here. And so I did my intern year in Sacramento, and then for the past 6-7 months I've been up here in Grass Valley.
Wow, that's great. Yeah, our residents start at Methodist Hospital in Sacramento for their first year, and then they come and focus on rural medicine up here, based out of Chappaday. And that's really great. So journalism, English degree, and into family practice care.
Yeah.
So was there something specific that inspired you to choose family practice over all the other specialties?
Yeah, I think when most people going into family practice enjoy the continuity of care, they enjoy being able to have a very diversified specialty or diversified practice, in the sense that we get to do a little bit of everything, and then we get to see people of all ages. So that breadth of practice appeals to a lot of family medicine physicians. For me, the experience I had going through medical school, and as I'm being exposed to different specialties, I left kind of each specialty thinking, I love this, I love doing this, I want to do this. But when I thought about going into any particular specialty, I mourned the loss of all the other specialties I wouldn't be able to do anymore. So when I did my rotation in family medicine, which at the University of Iowa was in a small town in Iowa, not so different from this one, that's where I found my passion and said, this is for me, this is what I want to be doing.
Great, yeah. So why don't you share with us a little bit about the day in the life of a resident? A little different than being a full-fledged physician. Well, you are a full-fledged physician, but a little different than the day in the life of a physician. Yeah. So what's that look like for you?
So every day is a little bit different. I go through different rotations, and so for example, right now I'm on what's called radiation oncology rotation. I get to spend a little bit of time with the radiation oncologists up here in the Grass Valley area, learning more about their specialty and the intention with each rotation, which also includes, for example, cardiology, OB-GYN, orthopedics, etc. We learn a little bit more about not just how to approach these conditions from a textbook standpoint, but how to take a more nuanced approach, learning directly from specialists in each field, and then also establishing relationships with them so that when I'm practicing in family medicine, I can reach out to them directly and kind of learn from them on how to manage patients in my clinic. And that's another component of residency. So although I'm on different rotations every couple of weeks, I also maintain a continuity clinic. And so for a half day, at least half a day every single week, I see patients over at Chappaday in family practice.
Okay, great. Yeah, so you get a little breadth of everything, and then, how, family practice physicians communicate with other specialists.
Correct.
That's great. That's very important. It doesn't always happen the way we would like it to, but I'm glad we're training you in the right direction.
That's right, yeah.
Is there a rotation specifically that you're looking forward to or you've enjoyed the most?
I've had really good experiences with all of my mentors up here. I suppose one that I am looking forward to in particular is my rotation that hopefully we'll be able to do soon in urology. The family medicine physician that I worked with in medical school actually was doing vasectomies as part of his training, as part of his practice. I've wanted to have that as part of my training, especially I know up here, access to urology as a specialty service has been challenging for patients, and so being able to offer that service in a family medicine clinic, I think would be really valuable.
Yes.
So I'm looking forward to that.
That's great. That's great to hear. I'm sure most people in the community are very happy to hear that.
Yeah.
So what made you choose a rural program versus all the other residency programs? Most people don't know. There's a match system, and you choose your programs, you rank them, and then you interview with the programs, and then there's like this whole match day that happens in March, and it's a very exciting day.
Yeah.
We love match day. But you could choose any program across the United States. Is there a reason you specifically chose a rural one?
Yeah. So I was primarily looking at rural locations when I was applying to residency, and there's sort of a couple different reasons for that. One is that when I was training in Iowa, a lot of the communities there, even the larger communities there, sort of considered small towns by California standards. And the thing that I really value about that type of community is the relationship that you have with your neighbors, the sense that when I see patients in the clinic, I'm kind of seen as not just their physician, but also a member of the community. And I really value that relationship in particular. And I also think that the challenges for patients in a rural community, which is, difficulty accessing healthcare, lack of specialist care, those same challenges actually create a better training environment for family medicine physicians, and that we have to become, out of necessity, we have to be comfortable managing a wide breadth of conditions that in larger urban centers might be relegated to specialist care. I think the opportunity for trainees in this area is that you do get comfortable managing things that you can't necessarily give to specialists. So.
Yeah, well, great. That's a really great perspective.
Yeah.
So as you look forward into your career and into the future, what do you see in your specialty in family medicine? What does the future look like in healthcare in our community in your specialty?
I hope for with family medicine is that people see the value of that patient-physician relationship. I think that the very factor of the existence of this program itself sort of speaks to how much people value having that relationship with their PCP or their primary care physician. The community buy-in for this program speaks to how much people want to see more access to PCPs or family physicians in the area. So I hope that is a trend that continues within family practice, and that that we continue to prioritize that relationship between patient and provider.
That's great. That's wonderful. Well, the Hospital Foundation's been very supportive of the program. We helped with the philanthropic funding, and we look forward to future expansions and supporting that, growing to more physicians at a time, looking at different specialties. Nick and I are working on a grant right now around street medicine. Yeah. I know harm reduction is a passion of yours.
Exactly, yeah.
And working, with the community as a whole to support patients. So I look forward to working with you in the future.
I look forward to that as well.
Yeah, and thank you for joining us for Doc Talks. You can find it on our website at supportsierranevada.org/doctalks or on Nevada County Media, or you can go to our social media at Support Sierra Nevada on Facebook and Instagram. Thank you for joining us.